How are sleep apnea, depression, and anxiety related? Have you ever wondered how sleep apnea connects to feelings of depression and anxiety? It is a question that many people face, especially those who struggle with sleep disorders. Sleep apnea, particularly obstructive sleep apnea, is a condition where breathing repeatedly stops and starts during sleep due to blocked airways. This can lead to fragmented sleep and a host of other issues. One of the most common symptoms of sleep apnea is excessive daytime sleepiness. This is not just feeling tired, it is a constant battle to stay awake and alert during the day. This overwhelming fatigue can worsen mental health conditions like depression and anxiety. When you do not get enough quality sleep, it can affect your mood and emotional well-being. Research indicates that individuals with sleep apnea often report higher levels of anxiety and depression compared to those without the condition. This connection exists across genders, but some studies suggest that women may be at a greater risk of developing these mental health issues. The severity of sleep apnea, often measured by the apnea-hypopnea index, and factors like body mass index can also play a role in how these symptoms manifest. Several mechanisms link sleep apnea to depression and anxiety. First, the poor quality of sleep can lead to changes in brain chemistry that affect mood. Second, chronic oxygen deprivation during sleep can alter brain function, making individuals more susceptible to mood disorders. Third, excessive daytime sleepiness can impair cognitive abilities and emotional resilience, which may contribute to feelings of sadness or anxiety. Lastly, the stress of managing a chronic sleep disorder can add to psychological distress. It is important to note that the symptoms of depression and anxiety in individuals with sleep apnea are not just coincidental. They often reflected the broader impact of sleep apnea on overall health and quality of life. Treating sleep apnea effectively, often through continuous positive airway pressure therapy, can improve sleep quality and reduce daytime sleepiness. This, in turn, may help alleviate symptoms of depression and anxiety. However, psychological factors can also affect the treatment process. For instance, anxiety about using a continuous positive airway pressure machine can hinder adherence to treatment. This highlights the need for a comprehensive approach that addresses both sleep apnea and mental health. In summary, sleep apnea, depression, and anxiety are interconnected through the effects of disrupted sleep and oxygen deprivation. Addressing sleep apnea can lead to significant improvements in both physical health and mental well-being, making it essential to recognize and treat this condition.